We've been working to try to understand racial disparities in chronic disease and other outcomes between Black adults and white adults in Allegheny County and across the country. So our 3 strategies are nutrition, physical activity, and community and clinical linkages.
The racial inequities in Allegheny County are vast. When we talk about racial inequities in the context of REACH, we're talking about Black communities specifically. We focus on chronic disease and community health, and so there are inequities in things like diabetes, hypertension, weight-related outcomes, but also access to resources that we know are important and critical for maintaining health.
The way that we are getting further faster to address the social determinants of health in our REACH communities is first and foremost, we brought together a multi-sector coalition that is committed to working together to address racial health disparities. We know that we are not going to reach our goals at achieving health equity and getting further faster to really reduce racial health disparities unless we implement and work on longer-term policy changes.
Community-based organizations within the REACH Coalition are very important. They are the foundation, they are the backbone of the work. When you're working with coalition levels, there are different things of need for technical assistance, and that technical assistance supports capacity building and also sustainability.
So our partners have worked in over 40 clinics, screening over 1,600 Black residents in Allegheny County to get them connected from their community into those clinical services.
And so we have to intentionally want to bridge the gap between those that need services and those who give services. And so I think you can establish trust by being a part of the community, not just telling them what to do, but showing them what's available to them as well.
Specifically related to the Healthy Start Center for Urban Breastfeeding, it was created in response to the disparities that we see in breastfeeding initiation and duration rates. And we know that there are numerous benefits for babies, and for moms, it can include decreasing the risk of some breast and ovarian cancers.
One of the main reasons that it is so important to bridge the gap between community and clinical settings is because we know that most of what impacts our long-term health impacts takes place outside of a doctor's office, outside of a clinical setting.
This REACH project has given us the opportunity to provide incentives for people to come to the table to participate in programs. And we are able now to have people call to do follow-up. When we check your blood pressure and your blood pressure is elevated, we don't stop there. And have you followed up with your physician? And if you tell us no, you don't have one, we help you navigate through the health systems.
Our participation in the Getting Further Faster initiative has given us the time and space to focus on the long-term sustainability of the Live Well Allegheny REACH Coalition, and also to look at those policy levers that we know are so important to impacting long-term initiatives that will impact health outcomes. And the only way that we're going to be successful is if every resident in Allegheny County can lead their healthiest life. That means that they have access to fresh and healthy food in their community, in their REACH community. That means that they have safe places where they can walk, where they can be with their children. That means that they have access to all of the preventative healthcare services that they need. And we will only be successful when every resident in our REACH community has access to all of those things.